new treatment modality for peyronie disease. It's an acquired inflammatory condition. There is a fibrotic lesion in the tunica albuginea, and there is a, if you palpate, there is a defined plaque. You can palpate the plaque on the penis. Plaque is usually on the dorsal surface. It can be at the left side or right side, or it may be a ring-like or plate-like. Nowadays we see large sizes of plaque. It causes severe pain during erection, and it causes curvature of the penis. This curvature causes physically and psychologically devastating effect on males. Peyronie disease is not a newer thing. From 1561, this has been described in history. First, Vesalius, he has described the curvature of the penis, followed by Fallopian. He has described the curvature of the penis, but De la Peyronie, a French surgeon, he has described in detail, and he has presented a paper on 1743. Hence, the disease is on his name, peyronie disease. It's a curvature of the penis. So, the curvature of the penis is due to a plaque on the tunica albuginea. Usually, it's on the dorsal surface, but it can occur anywhere. Okay, you can see the plaque, fibrous plaque on the dorsal side of the penis. There are a lot of myths on peyronie disease. Many people, they think it's very rare. It is not so. We see nowadays, very commonly we see. Because of the diabetes, we have, in India, we have 1.5 billion population. We are having largest number of diabetic patients. It's the capital of diabetes of the world. 60% of the diabetic people have sexual dysfunction due to diabetes, uncontrolled diabetes. A lot of people, they develop peyronie disease. So it is not a rare disorder. And the clinical presentation is the peak incidence, 4th and 6th decade. But nowadays it can occur in younger people also, 20 years, 25, 30. The problem is pain during erection and curvature. You can see upward curvature left or right side, downward. We can see curvature on all the sides. We can see a palpable plaque, hard fibrotic mass on palpation. Various etiology, including diabetes, taking ferritin sodium for fits or epileptic seizure, various other Paget's disease, various other causes are there, but very common is diabetes or any trauma in the penis. Female on top position, they try sex, slight trauma can cause peyronie disease. We can divide into active phase and secondary phase. Active phase, it will be, erection will be painful and there will be a changing deformity. Secondary stage, the deformity will be stable. Pain may be there or may not be there. The symptoms, usually either they come with pain during erection and there will be a curvature. Usually during erection, sometimes we can see in a flaccid condition also. The shortening will be there. There is a shortening of the penis because you see the straightening will be, in straight condition the penis will be long. When it is curved, it is shortened. And they can palpate the plaque also. So they cannot do sex. They don't have good erection. So they cannot have erection. They will be very much anxious, depressed. They have shame and embarrassment, guilt. So what are all the treatments available now? Now we give vitamin E in divided doses, 800 milligrams to 1000 milligrams per day. Potoba, potassium aminobenzoate, 12 grams per day. And various other drugs. We are giving colchicine, 0.6 gram, 3 times a day. But these medicines are not very useful. Tamoxifen, L-carnitine, all these things are not very useful. Potoba is the commonest drug used throughout the world. Internal lesion over the plaque, we give various drugs, corticosteroids. We give Vadapalani. Vadapalani is somehow it is very effective, but it is not dissolving the plaque completely, but it can break the plaque. To some extent, it is useful. Collagenase. Now we use collagenase to inject over the plaque. Collagenase 2, 1, 3, 4. All these forms of collagenase we are using in stem cell production, stem cell preparation. Now we can use it, we are using it over the peyronie disease also. It disintegrates the plaque. And that is collagenase, we can use it. Type 1, type 2, type 3, type 4, any collagenase we can use it. Over the lesion. And the interferons, we can use intralesion. Newer drugs like Xiaflox, it's available in US, 12 injections, but it is very costly. It is another form of a collagenase. And radiotherapy, nowadays it is banned. They don't use it. WHO, they are against it. And shockwave therapy. This is one of the latest treatment used for peyronie disease. Now, Shockwave therapy, we use it for stable and mature cases, 12 to 18 months period from the, shockwave therapy, we can use 12 sessions on the lesion. Surgical management, we do Nesbit surgery. We can remove the plaque. You can see the plaque in the middle slide. We can remove this plaque by Nesbit surgery, and we can do grafts, various grafts to fill up the empty space. So, now we have done a study with new therapeutic modality like therapeutic ultrasound. Therapeutic ultrasound is very, very effective to dissolve the plaque. We have done in around 250 cases. Yeah. 3 megahertz ultrasound is used, and we are applying the therapeutic ultrasound for 15 to 20 minutes over the lesion, and 20 sessions we have to do it within 2 months. We are seeing marked improvement with the lesion, disappearance of the lesion, or the size of the plaque decreased to, the volume is decreased around 90%, and the curvature disappears. So in our hospital, we are using this treatment for more than 10 years. Around 214 peyronie disease patients we have done the test. We have treated. We divide into grade 1, 2, 3. Grade 1, less than 0.3 centimeters, around 96 patients. Grade 2, 0.3 centimeters to 1.5 centimeter. Grade 3 is above 1.5 centimeters. So 97 patients with grade 2, 21 patients with grade 3. So other accompanying problems like alcohol, 26 patients, smoking, 38 patients, obesity 19, hypertension 11, diabetes 37. So grade 1 is 21 patients, and grade 3 is 21, grade 2 is around 97, grade 1 is 96 patients. So these are the distribution for various associated factors. So grade 3 associated factors, obesity and smoking, and are important contribution for 92% of patients. They have completed the treatment. In numbers, it is 197. They have completed the treatment. 8% of the people, they have not completed 20 sessions. 177 people, they are successful. Curvature became normal and pain disappeared. 20 patients, they have some amount of pain and curvature. It is not totally corrected. So results are, we have treated around 214 peyronie disease patients. Out of 214, grade 1 is 96, grade 2 is 97, grade 3 is 21 patients. 17% they have diabetes, hypertension 5%, obesity is 9%, smokers 18%, alcohol, those who are consuming alcohol 12%. Completed, those who completed ultrasound therapy around 197, incomplete 17 patients. Scar disappeared or plaque disappeared 177 patients. So this therapy is very good and cost effective, non-invasive, and the success rate is around 90%. Failure rate is 10%. Now we are using shockwave therapy along with this. It gives more success rate. Those who are having a bigger size or failures, we are using stem cell therapy also. We can give stem cell therapy intralesionally. It can dissolve the